Morning, everybody, wherever you're watching us from. Good morning, everyone. Good morning. Today's a beautiful day. I mean, this whole month is a beautiful month. It is Women's Month, and we are super excited. I am super excited to be here today on Ear Ground to talk everything women's health. It is our month. Every day really is our day if you think of it. Women are celebrated every single day around the world, but it's really heartfelt and humbling when we all know that we actually have a specific month where we're all celebrated and talked about and talk everything to do with women, to encourage each other, to pull each other, to support each other. So today I have three wonderful guests who some of them probably need no introduction because I know you know their work and you are aware of the things that they do. I am joined today by Dr. Maida. I am also joined by Sukriti Sharma, and we also do have our nurse practitioner from Vaskana Project, Jisine Zapasi. So I am going to allow them to introduce themselves and they can tell us a little bit about who they are and what they do and the work that they're involved in as well. So please, if you're watching right now, if you can click like and share with everybody else on all your different platforms that you're on, because all the information that these three women are going to be sharing today is very critical to other people as well who might not be able to watch it right now. So I'm going to go ahead and start off with Dr. Maida. If you can please go on and introduce yourself.
I don't know if you can hear me and if you can see me, but my name is Lydia Maida. I am a physician. I graduated at the University of Zimbabwe in January 2020, and so it's 2022 right now. I've been a physician for 22 years. I have been an obstetrician and practicing independently since 2010. I came to the United States in 2006 and did residency for 4 years, and am currently practicing as an obstetrician in Tampa, Florida, and am happy to be here and wishing you a happy March 2022 Women's History Month.
Thank you, Dr. Maida. And I know you just got a new position, which I just want to say congratulations to you. You are really waving off flag high, and we love the work that you do. We really appreciate you. I know you're you're such a humble person. Every time when I talk about your achievements, you always want to brush it off. But this is our month to celebrate you and to celebrate other women that are doing beautiful big things. So I really want to say congratulations to all the work that you're doing at the moment.
You are very kind, Magda. Thank you very much.
Okay, so over to Jisine. Go ahead and introduce yourself and tell us a little bit about your work.
Hello, everyone, and happy Women's Month. It's been so exciting. Thank you, Magda, for creating this platform for us women to share these important topics that are not otherwise shared elsewhere. So thank you so much. I really appreciate it. And Dr. Maida, congratulations. It's such an honor for you to join us, for these sessions and bring your expertise and knowledge to the subject. And welcoming our guest today who will be sharing her experience as well. I'm Jisine Zapasi Mamuta. I'm founder of Vaskana Project. And you all, most of you have seen me in the work that I do. I'm all period positive and just working to create period positive environments. And I'm based in Cincinnati, Ohio. Thank you.
And same thing as well for you, Jisine, you are doing big and bold things. You are the author of the period menstrualpedia book, which has taken a storm in Zimbabwe. And I mean, the achievements and the things that you have done, and at least that I have seen you doing in the past 4 years, is just phenomenal. So I'm really excited to talk about your book in a little bit. But otherwise, thank you so much for being here. And I look forward to all the knowledge and the education that you're going to share with us today. And last but not least is Sukriti. Sukriti, my Indian friend, Sukriti Sharma. Please tell us a little bit about who you are and what you do.
Thank you, Maggie. So, hello everyone. My name is Sukriti, and I graduated as a medical esthetician in 2018, and I've been on and off in the same field. Also, I'm a professional Kathak dancer, which is an Indian classical dance form. I've been dancing since my childhood, and I moved to Canada 6 years ago, and I have been performing and teaching over here since then. And I'm really honored to be on this platform sharing my story with some genius people over here, and whoever is watching today. I do want to say that please do take something from here, and it's a really important topic we are discussing today. And happy Women's Month to everyone. Thank you.
Thank you, Sukriti. That's really kind of you. I know you have a lot to share with us today in regards to your journey with fibroids. And we're going to go ahead and jump right in. I'm going to start with Dr. Maida. Please tell us, explain to us what fibroids are and exactly what happens when it comes to fibroids.
So, for the benefit of everybody listening, we should probably start with just saying fibroids are very common, and they typically don't cause any problems. Fibroids are growths that can be found on the uterus. And a lot of the time, when people have an ultrasound done and are told that they have fibroids, then they can get really panicked and worried that because they have fibroids, then they're going to have many problems that could be associated with fibroids. But probably 80% of the time, the fibroids are just an incidental finding and are really not going to cause problems for you. Past that, I'll say we would be perhaps more concerned about the fibroids if they were a larger size, and also concerned about fibroids depending on where they were inside the uterus. And so the position of the fibroids within the uterus would a lot of the time determine what the symptoms associated with the fibroids would be. And saying that, then we have like 3 linings on the inside of your uterus, and I should probably draw a diagram to show what the uterus would look like, and the lining, and then show you how the fibroids can affect things. Are you ready?
Yay.
We are. Yes, we are.
Yes, you are.
Okay, so we have a board right here, and I'm going to draw a picture of our uterus. And this would be the tubes going out this way, and the uterus opening over here, and this is supposed to represent the cavity of the uterus. And this would be the cervix. So this is the inside lining of the uterus that is supposed to thicken every month. And when it thins out, then you have your your period. So with the when you are pregnant, so then you're supposed to have ovaries out here, and you release an egg every month in your cycle. So you mature a couple of eggs every month in your cycle. One egg, the dominant egg, is typically chosen from one side or one of the ovaries, sometimes both of them, but usually one egg is the one that after after you've had intercourse and sperm has been released inside the uterus, then and travels this way, and the egg is traveling up inside the tube. Fertilization can occur inside the tube, and that way you can get pregnant. The fertilized egg would then travel into the inside of the uterus, and when you get pregnant, then it has implanted inside the uterus. When you are not getting pregnant, then the lining just thickens, and if there's no pregnancy, then the lining, the lining sheds because of how the hormones don't continue preparing for the pregnancy like it does every month. And so when you shed the lining, then that's what can be affected by fibroids. So this is the inside lining of the uterus, is the endometrium. The inner lining is the myometrium. You can have a fibroid just under the lining. This would be a submucosal fibroid if it were just under the lining, and sometimes it can protrude into the inside of the uterus. You can have a fibroid right on the inside of the lining of the uterus, and then you can also have like a subserosal fibroid that's in the outer lining of the uterus, and so it could be a pedunculated fibroid. And so if you have fibroids on the inside lining of the uterus, these can cause abnormal uterine bleeding and can also interfere with pregnancy. The linings in the myometrial lining, only when they are really big, they could cause problems, or if they are small but there's multiple fibroids, then they can affect the shape of the uterus, and by so doing affect things like getting pregnant and also your periods. But really, the typical thing is that fibroids are typically not causing any problem. So you can have like multiple fibroids and still just be able to get pregnant. And then these fibroids here on the outside of the outside lining of the uterus would be the subserosal fibroids. And so subserosal would be, if they were like just under the lining. So more on the outside, and then a pedunculated fibroid could also be considered it's on the outside lining of the uterus. I put it here, but it could also just easily be over here. And typically, these kinds of fibroids are perhaps kind of on a stalk, and they hang backwards or hang forwards and would mostly be a problem if they were large and were causing pressure on your bladder or on the bowel. So then they would be causing like pressure symptoms. And so they wouldn't be able to cause pressure symptoms if they were not really large. And so, as you can see, then depending on the position of the fibroid, or as in on the inside of the uterus or on the outside of the uterus, then that could tell you, how the fibroids are going to present, what kind of problems you could have with those fibroids, and then give us options for how to treat those fibroids. So that's in short.
I can never get enough of you explaining this stuff. And every single time when you do it, I always learn something new. Thank you so much for sharing that. I'm going to come back to you to ask a few more things. Is there anything else you wanted to add on, or you're good?
I think I'm good right now.
Okay, great. So I'm going to pass it over to Sukriti. I know you have had this journey of fibroids, and so tell us a little bit about that. How did you find out that you had fibroids?
Yeah, so in 2020, during the pandemic, when I was staying home, I did notice the excess bleeding during my periods, but I didn't pay attention to, and that I didn't see as a problem for me, because I was staying home. So I was like, it's okay, it's all good. But in the same year, I had to go to India. I was getting married in December. So my husband used to come home and we used to work out in the morning. That's when he figured out some tightness in my abdomen, lower abdomen. And that's when he asked me to go for an ultrasound. And then I got to know that I have a fibroid. And it wasn't that big at the moment, but we waited until we got married and start the process after. So yeah, I got to know after almost a year, I would say, that I have a fibroid.
And so during that process, after you found out, what then happened after that? How did you then decide to get it removed? What led to that point?
So I would say when I started the process, my I consulted the doctor. Asked me to go for a surgery, because I know the fibroids, when they are small, those can still be cured with the medications and change in the routine of diet. So my fibroid, she said that we have to remove it with myomectomy. So they had to cut the skin and then do the open myomectomy. And then when I asked her when it can be done, when she asked me to go for some tests, in which we figured out that my hemoglobin was very low, because I was having excess bleeding, and I also had a problem of frequent urination. So, as doctor just mentioned, that my fibroid was in the outer layer of the uterus. That's why I was having the pressure in my uterus. And even if I drink only a sip of water, I would go to the washroom and I feel like that I am just, emptying a bucket of water, because I could feel the pressure. I could not control it. Right. So, uh, uh, when I figured out that my hemoglobin is less, I mean, according to what I needed for the surgery, then I decided I'll come back to Canada and then do it. But then I also figured out that I do not have anyone in Canada for aftercare, and as my whole family is in India. So we finally decide to do it in India, and I started taking iron pills and taking fruits and vegetables to improve my hemoglobin, and that it will be a bloody operation. There will be a lot of a loss of blood during the surgery. So my surgery happened in February 26, 2021. When I went for the ultrasound in November, when I found about the fibroid, the size of my fibroid was 9 by 8 centimeters in November, and when I was actually going for my surgery, it grew up to 12 by 9.3 centimeters. It is a tennis ball size fibroid. And also during the surgery, my doctor also figured that there was a cyst in my ovary as well that was also removed. So yeah, that's how my surgery happened, and I had to stay in the hospital for a couple of days. And yeah, that's how it happened.
So I mean, it's really interesting on how every time when you hear stories about fibroids, everybody has a different story of how it affected them and how it went, and you know the whole journey. And I know that you had your surgery back in India, correct?
Yes.
Well, you had your surgery back in India, so I'm guessing that it was nice to have your family there for support as well, and not be walking on that journey by yourself. So thank you so much for honestly being so candid and sharing your journey, because I know there are probably some other women that are possibly going through the same thing or seeing some symptoms and are not really aware of how to start the conversation or even to share it with their physician. So thank you for sharing that, Sukriti. Coming to you, nurse practitioner, Gisine, what I wanted to ask is, when it comes to the book that you created, which I can see in the background there, by the way, it looks so beautiful. What I wanted to ask is, how can girl dads coming from Zimbabwe, we all know, you know, how it is. There's just so much, it's almost like a taboo, an elephant in the room when it comes to talking about periods, as we say, kwenda kumwedzi. Nobody wants to really sit down and talk about it. And here you are, you created this phenomenal book that you translated into our Shona language, which I know you had mentioned that you're also going to be bringing the Debele copy, hopefully sooner than later. No pressure. But can you tell me, in your own experiences, how a girl dad can be able to sit down with their girl child and talk about menstrual cycles and periods?
First of all, I think attitude and perception matters. So just as they are okay, the dads are okay talking about the respiratory system, the um, GI system, and the cardiac system, they should be okay too to talk about the reproductive system. I know our culture has deemed it taboo, but it's a natural process, and that attitude and perception should be, changed. And as dads, they can start off by changing their attitude and perception on periods, and start to know that periods is a natural, it's a natural happening, natural process that happens to every woman. Their mom, their sisters, their aunties, everybody's, goes through menstruation. So just changing the attitude and the perception. And then when that's done, that creates a period positive environment. Where the dads are open to even ask their daughters if they, have enough product, and when they are in the grocery store, they're okay with picking up products for their daughters. So that is very important, the creation of period positive environment, and that starts by changing their attitude and their perception on periods. And also, now that we've created this great resource, an educational tool, the dads can also purchase the book for their daughters, and that can be a conversation starter, and helps to make the child realize that their dads are also supportive in what is going through with them.
Fantastic. Thank you so much for sharing that. And I know that you also went through the journey of fibroids. Do you want to share a little bit about that and how your journey was compared to Sukriti's journey?
For me, I was very naive. So I found out I had fibroids when I was 24, and that was because I had a miscarriage. And my doctor, he just told me you have, when after the miscarriage, he told me you have fibroids, but I really don't think they could have been the reason why you had the miscarriage. And then later on, as I progressed in my life, I also experienced high risk pregnancies where I was bleeding throughout my pregnancies. And then, but still naively, I did not really think much of it, until later on after my third pregnancy. I also, in my teen years, I had heavy periods, and during my first pregnancy, I had anemia and had to take iron pills, but never correlated everything. And now that I've been more aware about fibroids, I'm like, aha. I was really, really very naive about the whole topic. And that's why it's really important for us to be educating each other and bringing awareness to this topic, because most of us, we really do not pay attention to the changes in our flow, in our cycle. We just tend to brush it off and then don't realize until we need a transfusion, or and our hemoglobin is really hit rock bottom. So that's why it's very important for me as an educator in menstrual health to also bring awareness to this important topic. And it's fibroids are very common for in people of color, and most of what I've read, it leads to. They say there's literature that says there's 1 in 9 women will have have undergone a hysterectomy. So it's really, and this is a topic that we are not talking to each other, and we are, because of the tabooness, because of the shame, the fear. Most of us, we are just journeying silently, But you still hear so and so has had a procedure, so and so has had a hysterectomy, and that's why for me it's really important that we bring awareness and really educate our younger generation to be more aware of their flow and their cycle. And these are great indicators of fibroids. Thank you.
Thank you so much for sharing that. And, I love your honesty of you saying that you were very naive about it. And I think this is something that goes through, but, times have also changed. Imagine your journey also pushed you into being this leader that you are when it comes to Menstrupedia. It also pushed you into creating a book, which is going to help the next girl child as well, who may be going through such a journey as well. So I'm going to bring it back to Dr. Maida, because when it comes to fibroids, I have heard all sorts of things. I have heard certain things of people saying, if you take this, if you drink that, it'll make the cysts go away, it'll make the fibroids go away. Especially in our Zimbabwean culture, there's so many things that people will suggest, which I'm pretty sure you have heard people coming into your office and telling you that, oh, so and so told me that if I drink this, they're just going to disappear or melt away. So I'm going to give you the floor so that you can tell us and educate us today of some of the myths and really the truth behind anybody that may be suffering from fibroids and how really they need to be tackling that issue.
So, I thought you might be asking about, myths surrounding fibroids. But I think it's just a general question of how to go about, or at least how we go about supporting somebody who has fibroids. Typically, when people come in to be seen, they're coming in perhaps for an annual visit, the visit that you're coming in to see the doctor once a year for, and you're not having any concerns, or maybe you are having concerns but are not really thinking to bring them into the doctor, like Jusine was saying, like, wasn't really having concerns, or what Shripati is saying about coming in with heavy bleeding. And so women are encouraged to come in for a yearly visit to see your gynecologist for a breast exam and a vaginal exam. And we are doing pap smears once you're above the age of 21 years of age, and then it can be individualized, but the frequency of having pap smears changes depending on your age and your risk for developing cervical cancer, because that's what the pap smears are for. And then with the breast exams, typically people are recommended for mammograms once you're at the age of 40, and then the frequency is typically every year, but there are recommendations that people may go by to reduce the frequency of that, but generally it's every year after the age of 40. And so people are coming in for to just have checkups. And so when people come in for checkups, then you may pick up that there's pelvic pain or some abdominal distension, like your belly is growing bigger, or there are heavier periods or irregular bleeding or prolonged bleeding. And these things may lead us to send you for an ultrasound along with your exam, and may come with the diagnosis of fibroids. So generally, if you're having abnormal bleeding, that's a reason for somebody to come to see the doctor. And we can do things that just promote health, like living, eating a healthy diet, increasing fruit and vegetables in the diet, putting in more physical activity. So walking for at least 30 minutes a day, and then, some exercise, and regular exercise helps. Looking at weight, so then reducing weight if you are on the overweight or obese side, sometimes helps with abnormal uterine bleeding. Typically, fibroids do not disappear. And typically also, like I've said, they are not going to necessarily cause a problem. When they are, though, like when there is abnormal bleeding, and we're not thinking to take them out, because initially we don't have to necessarily do surgery on them and remove them as a first, as the first line thing. And so first line, we are doing the healthy lifestyle changes, and then perhaps introducing medicines. And so a lot of the time, we have like some hormonal medications that we can give you, and the oral contraceptive pills can do some hormonal modifications and reduce the bleeding that you have. And so a lot of the time you can get like the birth control pills. We have other medications that we can give you to help to regulate your cycle and reduce the bleeding. So then there are also, other, there's different medications that we can give you. Like there is some medications that can reduce the size of your fibroid by introducing a state of menopause, sort of, and that can reduce the size of the fibroids. We would also consider, surgical options if this didn't help. And depending on where the fibroids are, so if the fibroids are on the inside of the uterus, we can go in inside the uterus. And so no need to make an incision on your abdomen. And so, like I was saying, if you have the fibroids on the inside of the uterus and we just need to remove the submucosal fibroid, we can introduce an instrument through the vagina, through the cervix. It's called the hysteroscopy. So then hysteroscopically, a hysteroscopic myomectomy and remove this fibroid. And so that would be a hysteroscopic way to remove the fibroid. Then these fibroids on the outside and also these intramyometrial fibroids can be removed through laparoscopic means and also an open technique. And so we can go and just perform a myomectomy, and this can be done through an open incision, but also a laparoscopic incision where we make a small incision at the umbilicus and then maybe small incisions just at the side of just in your lower abdomen, very small incisions, and remove these other fibroids. But if it can't be done laparoscopically, then open technique would also be another way. But with surgery and removal of fibroids, then there is that increased risk for excessive bleeding. And so there are means that we would put in place to, want for you to be at an optimum health state before we do the surgery to reduce the risk of complications after the surgery, and also perhaps reduce the risk for a blood transfusion. But with surgery for removal of fibroids, then there is risk for a blood transfusion. And so open myomectomy is an option. And then when the fibroids are removed, there is risk that, once the fibroids are removed, you can still get more fibroids afterwards. Might not necessarily cause problems, but the hysterectomy, which is removal of the uterus, would be the last resort for treatment of fibroids after other things had been tried and the problems were persisting. And so typically hysterectomy is not something that we would do, and hysterectomy is removal of the uterus. And we would consider, perhaps hysterectomy once you were done with childbearing, once the patient is done with childbearing, and so is not planning on having any more children, then the uterus can be taken out. But it wouldn't be the first resort. There are other ways of dealing with fibroids, like some radio frequency ablation, and also putting in some pellets to block the blood supply to the fibroids, which would make the fibroids small and then take away the symptoms of the fibroids. And that's called uterine artery embolization. And I think that's basically in a nutshell about the
Okay.
mental fibroids.
I have another question though. When it comes to fibroids, is it something that is hereditary, one? And two, when you're going for your yearly checkup, because this is something now that is so like at the back of my head all the times, and I hear your voice in my head always constantly playing in regards to this. But when you go for your physical checkup, right, like what are some of the things that one can advocate themselves? Because when I've done a physical checkup, there's really not any of this kind of talks that happen, unless if you're then telling your doctor that I'm going through this pain or here. But is there anything else in regards to advocating for yourself when you think there's some inconsistency or some unusual things that are going on in your body? So first, is it hereditary? And secondly, how can one advocate for themselves to make sure that everything is checked when you go for your physical checkup every year?
So, in terms of hereditary, I'm going to say that the genetics are going to be very complicated. And so if there is a history of fibroids in your family, then there may be some increased risk that you may have them. But it's not a simple, straight through, if your mom had fibroids, therefore you're going to have fibroids. It's multifactorial. There is, studies that have shown that perhaps women of color, and I'm going to say perhaps African Americans may have, multiple fibroids, and then Caucasian women may have, single fibroids, but a large fibroid. But I think it would just be one study, and there would be other studies that would show that that's not even completely true. So it's it's an individual. Everything would just be approached on an individual basis. Would be what would make sense. And so I'm going to say that the genetics is complicated, and so it's just not necessarily true if somebody in your family had them that you're going to have them. But having the testing done is not a bad idea. And so there, in that same vein, there are other conditions like breast. So then my screen kind of froze for a second. So there are conditions like breast cancer, and perhaps uterine cancer, endometriosis, multiple conditions that may run in your family that are also a complicated genetics and multifactorial, so that just because someone had it doesn't mean that you're going to have it. But it is a good idea to talk about it with your physician and let them know how it concerns you, because your doctor is always, waiting to discuss these, your concerns with you, and figure out which way to support to support you through the journey. And so perhaps
Thank you for that. Yeah, go ahead.
I was going to say, in terms of advocating for yourself, just perhaps going in with the questions that you have written down, so that you don't forget to ask whatever is bothering you. Also, sometimes people feel, like, Jisine was saying about how you can feel embarrassed, perhaps to ask questions because of the culture that we are, because of our culture. Then some topics would be, would be not very easy to discuss. But we do want to discuss things pertaining to reproductive health, and menstruation, and even with the sexual health. And so when people are having concerns, maybe pain with sexual intercourse, the vaginal discharge, sometimes there's concerns and embarrassment about vaginal discharge, and concerns that there is some foul smell coming from the vagina. Some foul smells are not even really like foul smells, and people are worried about vaginal discharge that is not really, that's not that's not abnormal. It's like normal vaginal discharge, and people are concerned. And so if you have an inkling of concern about it, discuss it with your doctor. Yeah.
Sounds good. Thank you for that. I'm going to pass it on to Gisine, if you can just add a little bit more from your experience, and if there's anything else that you'd like to echo from what Dr. Maida just mentioned.
I definitely want to affirm, throughout an experience and throughout my journey. As I mentioned, that I found out I had fibroids at the age of 24, and that was after a miscarriage. And then, I also experienced the heavy menstrual cycle, and I want to affirm that contraception does help with slowing down the flow and managing those heavy periods better. And then I do want to affirm too the preservative course that happens, and that hysterectomy is not offered while you are still of childbearing age. So I did have my, I went through high risk pregnancies twice, bleeding throughout those pregnancies. And after that, the medications they used was the Mirena to help me. It's an implant that they implant that helped me with slowing down my flow and could regulate my heavy periods. And I had Mirena for 5 years, the first cycle. And then the second time, I started experiencing more heavy bleeding. And also, I was getting complications with my bladder as well, as the fibroids had enlarged. So at the age of 42, that's when my doctor was like, finally, and gave me options, the myomectomy, and told me that my fibroid was too large, and also there was a risk of it coming back, so I would have to have surgeries if they were to return again. So at the age of 42, I finally had hysterectomy. So I just wanted to affirm that they do work with the patient, the doctors, do, if you are open and communicate and ask questions, to preserve, and hysterectomy is not like the first option that is offered to you. Thank you.
Thank you for sharing that. I wanted to ask Sukriti, since you've had your surgery, how has life been? Like, what have been some of the changes in your livelihood? How has your health been since your surgery?
Yes, so I'm doing so much better now. It's been a year since I have my surgery. So as I mentioned before, I used to have excess bleeding during my periods and frequent urination, which I could not control at all. So my state was like I was changing the pads in every hour, and I was always concerned about getting stained, my clothes getting stained, and whatnot. And as a professional dancer, I noticed that I was losing my stamina, and as compared to before, and I always wonder why that was happening. So since after my surgery, I it has been definitely a tough journey because I have never been away from my dance profession for this long. So I was asked for a 1 month of bed rest, and obviously it was open myomectomy, so there were stitches, and I had to wait for 10 days for stitches to open, and I couldn't, you know, use the stairs or walk a lot. But yes, I was recommended some exercises through my physiotherapist. So, and I was allowed to be away from vigorous activities and lifting, heavy lifting, for up till minimum 6 months. And but I still feel the pain and the stretchiness in my internal stitches as I am still recovering. And I think what I have heard so far is the internal stitches take a lot of time to heal. Like it comes and goes. Like if you get hit from a tabletop or when you are in the kitchen cooking, the the shelf, if you get hit on that part, you feel the pain. So it's still in the recovery mode, I would say. But I'm glad that it was diagnosed on the right time and surgery could happen. And my family was really supportive, and I was not at all scared. I did not panic, and I did not know about fibroids until I found out in myself. I had never heard about this word. And when I actually got to know about it, my mom told me about it, that this is really common in women and nothing to worry about. So even when I was going for surgery, I was smiling. I was just asking time to my doctor, oh, when will I get free? Oh, only okay, 4 hour surgery. And so when my surgery was starting, I was like, okay, 12:30. When I came back to my ward, it was 4:30. Okay, 4 hours. So I was chill. I didn't panic because everyone around me was so supportive. I had just gotten married. My husband was supportive. My in-laws, my family, my mom's side, everyone was so supportive and very encouraging, very motivating. So I didn't feel a lot of stress. And I would also like to mention that in the symptoms, I would say there's excess bleeding, there's frequent urination for sure, but emotional hormone imbalance, I would say, is also one of the things, because it happened to me in the pandemic time and I was all alone in my home. So I did have that emotional imbalance, maybe because I was alone, or maybe this was one of the reasons as well that I was feeling it. I used, sometimes when in a while I would just cry out loud. So, yeah, so this is also one of the cause, and you should definitely share your thoughts and whatever you're feeling to, if not right away with the physician, but with someone you can, talk about it. Because I know, as everyone mentioned over here, it's our society that does not allow us to talk about these things. But I am really open about it, and today I'm very proud that I could share this story with everyone here.
Thank you.
I honestly, really and truly, you gave me goosebumps just hearing you talk about this. like you said, it's one of those things that I think, like, now, we talk about everything else, and this is such a significant part in women's reproductive health, but we seem to not talk about it. Or, as you said, imagine you didn't know about fibroids until you went through what you went through, but your mother did know about it. But then again, we just never think about talking about these things. I mean, I have a 10-year-old and a 15-year-old, and I'm constantly talking to my 15-year-old and asking her how her period is. Does she feel that her flow is heavy? And because this is how these conversations have to start, and actually realize if there is any significance or any characteristics during that time when you're having your period. So I'm grateful to hear all these things, because I get to keep all this knowledge and information that you ladies are all sharing, so that in the future as well, I am comfortable with talking to my nephews about it as well, so that they're also aware one day, whether it's with their girlfriends or, with their kids as well, right? My husband as well. Like, it's really important to talk about these things so that they also know how to start the conversation. So I'm really grateful that you women are here and we're talking about this. I wanted to ask Dr. Maida, back to you again. What is Previa? So this is something that I heard some pregnant women who are going through fibroids, or who have gone through the journey of fibroids, seem to also have. Can you tell me, or tell us rather, a little bit about what Previa is, please?
So, Previa, with Previa, it sounds like you're talking about Placenta Previa. And Placenta Previa would become relevant in somebody that's pregnant. Typically, when people are going to get pregnant, many of the pregnancies are unplanned, but that doesn't make them undesired. A lot of the time, people desire pregnancy and are not completely consciously aware of it, or but we recommend, if pregnancy is something that you want to proceed with, then it's a good idea to be taking prenatal vitamins and optimize your health, and also see the doctor before you get pregnant, if it's possible, around the time that you're getting pregnant, so we can optimize things and talk about what our plans are going to be with pregnancy. In terms of exactly what Placenta Previa is, like in this diet with the uterus, then the pregnancy is supposed to implant. So then when the pregnancy implants up here in the upper segment of the uterus, so it would implant, like over here, that's what's normal. So then when your pregnancy implants in the lower uterine segment, it can implant right over the opening of the uterus. And so if it implants over here, that would be Placenta Previa. So the Placenta Previa is basically a low-lying placenta in pregnancy, where the placenta is in the lower part of the uterus, and can, and if you have Placenta Previa, then we would consider you for a cesarean section for your delivery. My screen is frozen, so I'm not sure if you can hear me.
We can still see you. We can still see you. And the last part that you mentioned as well. Yeah, that's what I was going to come back to ask, because that's what I've heard, that when you've had the Placenta Previa, you can only have a C-section. You cannot have a natural birth anymore, right?
Yes. So for that pregnancy, the pregnancy that you have the Placenta Previa in, then we would be considering you for a cesarean section delivery. But the pregnancy after that, if it's not Placenta Previa, you may be considered for a vaginal delivery. A lot of the time, the people that are at increased risk for Placenta Previa would be patients, women who have multiple pregnancy, because then you have, if you have twins, then you have a bigger placenta or you're going to take up a lot of space for the placenta just because there's two babies in there, and so the risk of implanting in the lower uterine segment would be higher. If you have scarring in the uterus, for instance, like you've had a C-section before, somehow the risk of placenta previa becomes increased. And so with the fibroids, if you've had, the myomectomy or some kind of scarring on the uterus, you can be at some increased risk of placenta previa, but not necessarily. And so, and then on occasion, which is most of the time, there are no risk factors really, but you have low-lying placenta, and we find that you have placenta previa, and the need for a C-section becomes the plan. Occasionally, because we do an early ultrasound in the pregnancy, we may find that the pregnancy appears to be implanted in the lower uterine segment, and the placenta is looking like it's as though it's low, and you may be at increased risk of the placenta previa. But when the uterus grows bigger, then the uterus grows bigger, so then there is more definition in your uterus, and the upper segment grows bigger. It almost appears as though the placenta moved away from the cervix. It didn't really move away. It's just the uterus has gotten bigger, and so now you can see that the placenta is not laying. It's not as low as it was looking at the beginning of the pregnancy, and so a lot of the time it looks like you have placenta previa right there at the beginning, but we call it a low-lying placenta. And then as things get more defined and the pregnancy is bigger, older, with increasing weeks in your pregnancy, then we can see that it's not previa. But yes, if it persists and the placenta is attached right here, then the baby can't come through here because the placenta is what's leading, and so you end up with a cesarean section.
Thank you for that. That's really informative. And I only ask this because, again, you know how social media is. I saw one lady talking about it on Instagram, and I just wondered, and I wanted to hear from, obviously, your professional background, exactly what that is about. So thank you for clarifying that. Gisine, so I saw that you're in a book with one of the people that I admire and love so much. And when I saw this, I was so excited. So I noticed that you are in the current book, which was written by Dr. Tererai Trent. I am just like, oh my gosh, tell me more, please. I need to hear more about this and how you're in this book and how you're playing a role in this upcoming book of Dr. Tererai Trent.
Well, I still cannot believe it myself. I still pinch myself like, is this really happening? But anyway, Dr. Tererai Trent is publishing an anthology. This year, the book is going to be published. It's going to be coming out in June. So she invited women of different walks of life, different nationalities, to apply to have their story shared in the book. So there were about 169 applications, and I was selected to be among the 36 women that are contributing their chapter in the book. So the book is titled Sacred Promise, and my chapter is going to be titled, it's titled Silence Journeys. And in that chapter, I share my journey, and my sacred promise to end the silence on reproductive health, as well as carry my mother's legacy. So it's very inspirational, and I still, just cannot believe that I'm standing shoulder to shoulder with these amazing women that are sharing their stories as well. And among those 36 women, I think 4 of us are from Zimbabwe. So it's really a great opportunity and just a powerful platform for us to be able to share our stories to the world and bring awareness to the subject that we care about and the work that we're doing. And so I'm excited. There'll be more details about the book launch and pre-order sales that are coming up. And so, yes, so excited. Thank you so much.
I am, you don't understand. When I saw when I saw that you were part of this book, I literally got goosebumps, and I, like a little child, I was jumping up and down with joy. And then of course the next thing that came to my head was, oh my gosh, you could actually be meeting Oprah one of these days, you know? So you know what I mean?
She's
No,
gonna
really,
read my story.
I am putting it out in the universe. You are going to meet Oprah. You all remember this day today that I say this, you know? So I'm putting it out in the universe. You are going to meet Oprah, and you're going to sit there shoulder to shoulder with Oprah, sharing your story amongst with other amazing women who are so candid. And, you know, there's so much vulnerability that happens on this journey of people that have gone through this journey of fibroids and all the other reproductive health issues that happen in women. So to have you, somebody that I know that's going to be rubbing shoulders with Dr. Trent, makes me feel so joyous and so proud of the work that you're doing. So thank you so much for sharing. We will definitely stay tuned. You know how much I hype things and people I love. So come June, I am going to buy my copy. I'm going to tell everybody else to buy their copy as well. I know Dr. Maida there's like, me too. And of course, Sukriti is like, me too. I'm going to purchase the copy. So as we round up our talk today, Sukriti, what are your last words of encouragement? Anything that you want to say to any women out there in regards to fibroids?
Yeah, so I would like to mention that I would like to say, if you feel any of these symptoms, please go and consult your doctor right away. In most cases, as mentioned before by uh, more people over here, the nurse and the doctor, that this can be cured through medications and routine in the change in routine in diet and exercising, and definitely you might not have to go for surgery. That would be great, right? And also, do not stress yourself and overwhelm with anything you are not able to do. Try to indulge yourself in the activities you like, so that you are not going through emotional imbalance, which I also mentioned that I went through too. So, and I don't want you to go through that. And also, I went through this phase. Everyone around me supported me, cared for me, made me feel strong. I'm stronger, like, I'm stronger than I thought I was. My favorite phrase has been, this shall too pass. And now I really understand it well. Why is this saying, so. And also I would like to mention that, uh, as it was mentioned before, that we are not able to talk about these to our dads, brothers. Other than husband, we definitely talk about it, but some women are not able to talk about it to their husbands as well, I would mention that. So we should be able to talk to them. In my scenario, if I need something like sanitary pads or anything related to, I would, if I'm not able to go out of the house, I would just call my father, my brother, and they would just take care of it. So I was really open, and my home, I felt like home when I was in the situation. So that was a really positive part in my family. And still, in my, after getting married, my family, other family is also very supporting. So I would like to mention uh, at last that my husband, my mom, my other mom, and the rest of the family was with me throughout the journey, and they helped me recover so that I can come back to Canada on my own and start my own routine as a dancer and a normal human being. I'm really thankful for all their love and support, and to you, all three of you as well, to listen to me today.
Oh, thank you for sharing. That is so heartwarming, Sukriti. And listen, and the reason why, honestly, I picked you to share your story is because so that people understand that all different cultures, ethnicities are going through this, and also to realize that we're all very similar in ways that we don't actually realize that we're very similar. But I love how you shared that, it's all about just starting the conversation. And once you start the conversation, your loved ones are always going to be able to support you. So thank you for sharing that. Dr. Maida, any last words, anything that you'd like to share before we close out?
It's been lovely listening to Jesine's account, and I am proud that you're in Dr. Tirarai Chen's book, and we're looking forward to it. So this is something to look forward to in June. I'll be there for that. Like the pre-orders. Mine is one of them, and yeah, congratulations. To City, I have to say it's been wonderful meeting you, and it's a lot of fun. It is very interesting listening to you, and it does sound like the dance is very important to you. It would be fun to see you dance at some point. And so it's been nice meeting everybody. I was going to say, in terms of questions to ask your doctor, no questions are considered silly questions or dull questions or irrelevant questions. If you are concerned about it, it is something that should be discussed. And I'm an obstetrician and gynecologist, and so sometimes people don't really want to discuss some things like I'm not sleeping that well, or I just don't feel so great. But if it's something that I feel we would need support from another specialist, I would be recommending, sending you to another physician, so you get, what is the best support that we can, get. And so, with that, if you feel you need to see the doctor, see the doctor.
Thank you for sharing that. That's really, informative. Everything that you mentioned today, like I say to you, I feel like I have heard you say the things that you say today, but every time when you talk about it, it's brand new again. It blows my mind on the things, especially when you do the diagram. I'm just like, oh my gosh, one of these days I shall draw this diagram too for my girls and show them exactly what happens. But I absolutely love how you're so detailed and explain everything that happens on the inside, because we just see what happens on the outside, right? Like what Sukriti was talking about in regards to the emotional imbalance and everything else, the peeing so much. But then when you see it from the inside, exactly what's going on, this is something, again, that is very eye-opening to realizing the importance of taking care of your reproductive health as a woman. So thank you, Dr. Maida, for sharing all your wonderful knowledge with us. And last words, Gisine, what would you like to say?
I just want to, just affirm what Dr. Maida said and say, be your own advocate, listen to your body, so you are able to identify more, when something is amiss or something is wrong. And it is very important to know your flow, your regularity, your cycle, so you are able to identify these changes. And if you have a concern, to talk to your healthcare provider, and if they don't listen to you, to find another healthcare provider, until to keep looking, to searching, because sometimes our concerns are brushed off, but keep on looking for that one provider that listens to you and advocate for yourself more. And also I wanted to just add on that how important for diagrams when you are explaining these things, and in our menstrual health book we do have some diagrams that help the child to understand exactly what is happening when to inside of them during their cycle. And as you all know, we made the book in Shona so that our girls can know and understand that it is okay to say these words in our language. It's okay to talk about this topic in our own language. So, and as always, just to continue opening up and talking to each other about these things, because nothing changes until we all do something about it. So I just want to urge women to be self advocates and to continue to build these environments where we can talk about important things that matter, because our health is the most important thing. Or everything else does not matter if you don't have your health together. And I just want to say thank you, my Sis Magda, for organizing this and creating this platform. It's very important for our community, to have this awareness and knowledge, so they can better advocate for themselves. And Sukriti, it's really great meeting you, and your openness in sharing your story. Really appreciate it. And your story is very relatable, not just to me as a fibroid survivor, but to other women that are out there, that are silent, that are not. Have fear of sharing their experiences, fear of judgment, of people, questioning them, and Dr. Maida, I'm just, every time I listen, like Magda, I'm just blown away, like, oh, how does she remember all these things? But it's just been an honor, and I look forward to more of these talks next year. And look out for the Sacred Promise that's coming out, and hopefully we can do a big launch. And yeah, thank you so much. And
absolutely. We are definitely doing a big, huge book launch on this. And you know me, we are going to do so many lives. They'll be sick of us. They will definitely start loving us. They won't have a choice. So really and truly, thank you, ladies, for today. And I know that you all have very busy schedules, but I will possibly am going to bug you. I know Dr. Maida is busy going, Maggie, don't ruin my schedule right now. but the heart inside of me is saying this needs to be done on Instagram. I know that we try to do the platform of YouTube and Facebook, but there's so many people as well on Instagram who don't have the access to Facebook and YouTube. So I'm going to figure out with your calendars. And I know the two biggest ones that I really have to bug is Dr. Lydia and Jusine, but we'll figure it out hopefully before the end of the month, and we can bring it onto Instagram and share your stories as well, and share with other women from all around the world. All these things that you were mentioning and talking today is so imperative for all the other people to hear and understand about it. Otherwise, thank you all for today. This has been wonderful. Happy Women's Month, and I will see you all soon. Take care.